So FDA guidance could affect a little bit of what Medicare is doing. I think that the FDA and CMS are going to have, some lessons learned moving forward. But I also think there's a lot of other really big issues coming up around the Medicare program in general that could affect biosimilars, that could really affect all products. So a couple of those things that I think are going to be hot button issues. I'll start with just biosimilars in general. Right now, a biosimilar, the originator product has its own billing code, and all biosimilars to that originator product are grouped together into a billing code. The industry, a lot of members of different biosimilars forum and other councils for biosimilars have not been interested in keeping it that way and have been working very hard to ask that they each get their own code. They're saying that these are products that are each unique, they're not biosimilar to one another, so grouping them together is quite confusing for providers and was not necessarily the intent of the BPCIA when that legislation was passed. So there is a lot of tension there with that with CMS and people asking for them to split the codes up. Then you've got MedPAC coming in and they're saying we want to simplify the whole system here, and what we'd like to do is we'd like to see the originator product and the biosimilar group together and share a code. And when that happens, you're going to see the price of that originator product drop substantially, and that will really save the Medicare program money. And while in theory, yes, that probably could save money, the intent of the BPCIA isn't necessarily clear on, that might not be possible. That might not be something you can do legally, is group those products together with the way that the biosimilar is defined. So that's going to be something that has to be ironed out, and you may see some guidance as interchangeables come to the market and FDA irons out interchangeables. You might see them say, how are we going to treat that? Are we going to give that its own HCPCS code, its own separate billing code? Are they going to be grouped with all of the other biosimilars? Would they even share a code with the originator product because they're an interchangeable? We just don't know yet. So that is something that could be a concern or an issue for biosimilar manufacturers, is just really ironing out payment. Also, just seeing some of the other pressures to control drug prices. That's a huge hot topic right now on the Hill. Are you going to see CMS doing significant things to change the average sales price-based payment methodology that they have for Medicare Part B drugs? Could that happen? And if so, how will that affect the market? So I think you've got kind of what's happening in general, and then how will that affect biosimilars just as much as how is the biosimilars market going to change. On the Part D side, we will definitely need to see some more clarification on if a biosimilar can be considered a brand. That is something that manufacturers are pushing for and asking for that clarification so that they could offer that 50% rebate in the coverage gap for patients. So that's something that will be defined. I think more and more MedPAC has recommended that be put in place, so we'll see if that actually happens in the future.